Welcome to another episode of Med Madness, your go-to channel for all things USMLE. Today we'll be delving into the evaluation of atypical glandular cells, or AGCs, on a Pap test. AGCs are significant markers for potential neoplasms and may indicate either cervical or endometrial adenocarcinoma. Proper evaluation of AGCs is crucial as it helps guide the necessary management steps. Let's explore how AGCs are evaluated based on patient age and history. Next, let's discuss general information on AGCs. AGCs on a PAP test are abnormal cells that can signify serious underlying conditions, such as cervical or endometrial adenocarcinoma. Identifying the source of these cells is critical for determining the appropriate treatment. Next, let's discuss the importance of determining AGC origin. It's imperative to identify whether the atypical cells originate from the endocervix or the endometrium because this determines the subsequent management plan. If the atypical cells come from the endocervix, a cervical excisional procedure, such as cold knife conization, is indicated. If the atypical cells originate from the endometrium, a hysterectomy may be required. Now let's consider a real-life case study. A 42-year-old woman comes in for her routine Pap test and the results show atypical glandular cells. Given her age, she requires a comprehensive evaluation involving colposcopy, endocervical curettage, and endometrial biopsy to determine the source of these abnormal cells. This thorough approach ensures that any potential neoplasm is correctly identified and managed, preventing the progression of serious conditions like adenocarcinoma. Now let's move on to evaluation protocols. The approach to evaluating AGCs depends on the patient's age and specific risk factors. For women aged 35 or older, or women younger than 35 with risk factors such as abnormal uterine bleeding, anovulation and obesity, the following procedures are recommended: colposcopy, which allows a detailed examination of the cervix, vagina and vulva for signs of disease. Endocervical curettage, a procedure to scrape cells from inside the endocervical canal to check for abnormalities. Note that this is only performed on non-pregnant women. Endometrial biopsy, which involves taking a small sample of the endometrial tissue to test for cancer or other issues. Again, this is performed only on non-pregnant women. For younger women without the previously mentioned risk factors, the following procedures are recommended: colposcopy and endocervical curettage. To recap, atypical glandular cells on a Pap test necessitate careful evaluation to rule out serious conditions like cervical or endometrial adenocarcinoma. For women aged 35 and older or younger women with risk factors, a combination of colposcopy, endocervical curettage, and endometrial biopsy is essential. Identifying the origin of AGCs guides the necessary treatment, whether it's a cervical excisional procedure or a hysterectomy. Don't forget to engage with our pre- and post-podcast quizzes and utilize the Anki flashcards to reinforce your learning. Thank you for tuning in to Med Madness, and we'll see you in the next episode.